As you enter a patient's room or bed space, you'll notice that there's aprons and gloves on the wall outside each room. You should use these if you're going to perform any clinical skills with the patient. You'll also see a folder, either outside the room or at the bottom of the bed, that has some information about the patient. As you enter the patient's room or bed space, sometimes these rooms are four-bedded, sometimes they're single rooms. You see a sink that has alcohol hand gel, hand soap, paper towels and an orange clinical waste bag. Clinical waste that can go in there. It tells you on the bin. As we move around into the bed space, you'll see there's a patient's bedside table. We have a locker, bed where you will normally find a patient, and a chair. We also have a television. In this locker you'll find that the top drawer is locked, and this is where the patient's drugs tend to be, and the nurses have the keys. You shouldn't have any reason to go into this locked compartment. So there's a few things around the bed space and you might wonder what they are. First of all, the yellow tube is for suction, and this is the point where the suction is operated from. If you need to use suction to clear blood, vomit or any other secretions from a patient's airway, you simply turn it on and then use the plastic Yanker suction catheter that's attached to the tubing. If you use this, it should be replaced with clean protective tubing afterwards. You simply place the catheter into the back of the patient's airway and remove secretions. Anything that's collected will then go into this blue and red container here, which is the suction unit. You'll also find oxygen, which comes from the white oxygen point on the wall. At the back of every bed space you'll find these oxygen flow meters. You can turn the oxygen flow meter to give the required amount of oxygen for the patient, up to a maximum of 15 litres per minute. Attached to the oxygen flow meter is the oxygen tubing, with a mask on the end that is then put onto the patient's face. You'll also find at the back of every bed space an emergency buzzer. If you find that your patient is in cardiac arrest or has fallen or is in any way unresponsive, or you have a problem, then you can pull this buzzer here that says emergency pull. This will bring people from up and down the ward, and you should have help very quickly. This is not the same as a 2222 call in the event of cardiac arrest. The patient also has a buzzer attached to a cable that should be within reaching distance of the patient at all times. If they need the assistance of a nurse, then they press the orange call button, and you'll see that a light appears here, and also that same light will appear outside of the room so the nurses know who is buzzing. You can press this button to reset the buzzer, but only do this if you've attended to the patient's needs. Otherwise, nobody will know that they've requested assistance. On this buzzer you'll also find a light switch and television controls. The other thing that you should be aware of when you're at the patient's bedside is the cot sides. If a patient has cot sides up when you go to spend time with them and you have to put those cot sides down for any reason, please make sure that you put them back up. There's a pull button at the bottom of the cot side, and this is what you use to release the cot sides. These are to stop the patient from falling out of bed, and as I said, if they're in place, it's really important that you put them back if you put them down. You'll also find some controls for the bed, so this allows you to adjust the height of the bed If you need assistance using these, then you can ask the nursing staff to help you. So that's a brief introduction to the bed space. We hope you found it helpful, and we hope that it will help you just to orientate yourself to the patient's environment. But the best way to find out about it is to get out and practice for yourself. So when you first approach a bed space, or if there's an empty bed space on the ward, then you might want to go and see if you can have a go at switching on the oxygen, switching on the suction, so you can figure out how these things work.